Hey everybody, welcome to my YouTube channel. We're going to be filming some surgeries coming up, so I just wanted to introduce myself and tell you a little bit about who I am. I am a board certified plastic surgeon in a suburb of Dallas. My surgical training has kind of been all over, and I'm also in the United States Army Reserves and a combat veteran. About 90% of what I do now is cosmetic surgery, but we also do some pretty cool reconstructive stuff as well. Thanks for checking us out.
How long have you been in the plastics field?
So I finished medical school in 2005, and I did a otolaryngology head and neck surgery residency. That was 5 years after that. And then I did 2 years of a plastic surgery residency. So since 2005, essentially, I've been in surgical training and in private practice.
What made you change from doing ear, throat, and nose to going into plastics?
Right. So why did I change from ear, nose, and throat to plastic surgery? You know, there's quite a bit of plastic surgery within ear, nose, and throat. And the ear, nose, and throat training gave me a great anatomy base in the face and the neck. And it was pretty easy to learn kind of breast and body after that. The things I did in plastics within ENT, I enjoyed the most. So at that point, I just decided to dedicate everything toward plastics, and it was a good choice. I love what I do. I wouldn't trade it for anything in the world.
So would you say doing that ENT residency put you ahead of the game?
I think it definitely helped because you just know the facial anatomy so well. And when you're operating on the body and the breast, there's not a lot of anatomical structures that you can there's not a lot of anatomy that you can really injure somebody if you don't know it. In the face, there is anatomy that you can injure someone if you don't know it. There are nerves that allow you to move your face and several structures where if you don't have a comfortable working knowledge of that anatomy, then you can get into trouble. So I'd say from that standpoint, definitely.
So that kind of leads me to my next question. What would you say your favorite surgery is to do?
That's a tough one. Probably abdominoplasty or tummy tuck. The results are just so dramatic. I enjoy it, but also, breast augmentation too. They're both patient groups are so happy after they get done that makes it just an enjoyable thing to do.
And what would you say the majority of surgeries are that you do?
I probably do more of those than anything. There's just, more people now looking for tummy tucks and breast augmentations than there are for facelifts. I still probably do about one facelift a month, but there just aren't as many people out there now looking for facelifts like there, were maybe 25 years ago. Botox and fillers and things like that can kind of delay a facelift a lot of times, so we just don't do quite as many as we used to.
What is your personal mission with plastic surgery?
One of the things I like about plastic surgery is you never stop getting better. And I will look at my before and after pictures routinely, old ones and recent ones, and not with rose-colored glasses on. I look at them and I think to myself, what could I have done to make it better? And I think that would probably be my personal mission, would be to continue to achieve perfection or excellence.
So if a patient were to approach you about a surgery, how would you go about that?
So my philosophy when patients come in and want to talk about a breast augmentation or a tummy tuck or anything cosmetic is kind of listen to what they want and then let them decide within reason as long as it's safe. I'm not the type of surgeon who demands that a woman take the size implant that I suggest. They're her breasts. She has to live with them. Why would I get to decide what the implants are? Now, I guide her. So if she wants to go really, really, really big, and I don't think her skin's going to be able to handle it, then of course we don't do it. But within some guidelines, I let I let the patient choose what they want. It just makes sense to me.
We all know that people have a lot to say about plastic surgery in general. What would you say about the stigma around it and how to maybe move past it or do it regardless of what society might say?
So I don't worry too much about the stigma of plastic surgery. You know, it gets, on one hand they say it's vain, and on the other hand they also say that you know, people look really overdone and crazy after plastic surgery, and you do see some of that, and a lot of that comes out of Hollywood. But you know, those people who look overdone are just that. They're over-operated on and overfilled, and it's just not a good look. And one of the first things I do when I'm talking to a potential patient is, I'm not gonna let you look overfilled. I'm not gonna let you look overdone. So just don't worry about that. It's not gonna happen. And then on the other hand, just from a kind of a, you know, the stigma of plastic surgery, quote unquote, if I can make somebody feel better about something that's been bothering them their entire life, and I can safely do it, why not do it? It's a great thing to do for someone. And you know, when we do it, you see their entire attitude change. They feel better about themselves, and you can safely do it. It's great.
So would you say you have a more natural approach when it comes to doing surgical procedures?
I would say I listen to the patient, and if they don't want to look natural, you know, they want to have giant breasts that don't look natural, I counsel them on, you know, the risks of doing that in a lot of detail. And if that's what they want, that's what we do. If they come in and say, which is more common, that they come in and say, I don't want to look like that, well then, you know, we create that for them. My goal is to get every person who leaves here to leave happy. And if that means we operate on them and do 6 hours worth of surgery, great. If that means I tell them, hey, you know what, I don't think I can make you happy, then that's okay too. But the goal is for them to leave happy and better than they were when they came in.
So something that I've noticed, especially regarding women, is that they somehow believe that their beauty is going to be discounted if they do have a surgical procedure done. Like, take the Kardashians, for example. So many people will say, well, it's all fake anyways. So, as if that discounts their looks completely.
Well, you know, regarding the Kardashians, they're absolutely beautiful. And I don't think that any surgical procedure you have is going to discount that. And I think that I couldn't disagree more, to be honest with you. Millions of women every year get Botox. Is all of their beauty discounted because they've had Botox or filler or breast implants? The notion to me is silly. If, again, it comes back to not really what other people think, it's kind of what each individual man or woman wants. And if I can make them feel better about themselves by doing a breast augmentation or a tummy tuck or liposuction or Botox, then I'm gonna do it all day long. And I think by and large, people are okay with that. I mean, so to summarize, if you want to get breast implants, or you want a tummy tuck, or you want liposuction, there's nothing wrong with it. There's nothing wrong with wanting that. So if you want it and you don't have any, you know, illnesses that make it unsafe, then do it. There's nothing wrong with it.
To wrap this up, what is your philosophy in cosmetic and reconstruction surgery?
My overall philosophy is we avoid the fake look and we give the patients what they want. That's always our goal. That, if I could sum it up in 2 sentences, that does it. And you know, with all that being said, I hope you enjoyed this video. Don't forget to subscribe to my channel so you can keep up with all of our surgeries.